Hi guys, Dan here from the Physio channel. In this video we're going to have a look at how to treat a meniscal injury without surgery. So if you've been diagnosed with or have a patient with meniscal damage, the good news is that it's possible to restore the knee function without the need for surgery. If you're looking for clinical tests of how to diagnose a meniscal tear, then have a look at the link above. Let me share a couple of facts with you about meniscal damage or age-related changes. Now, these are increasingly common after the age of 40. See the diagram on the screen here, for example. The meniscal degeneration often occurs without symptoms, so don't worry about the structure of the meniscus and its condition too much. The next bit of good news is that exercise will help to restore knee function even if you or your patient is experiencing some locking from their knee. So let me take you through some special exercises that you can try yourself or with your patients. Before we load the leg with some bodyweight exercises, first here are some easy self-mobilizations that you can do. In a seated position, we're going to gap the joint as we move into flexion. And to do this, you can use a rolled up towel right underneath the back of the knee and then get your patient to passively move the knee into flexion. And this may increase the range of motion and slightly alters the mechanics of the joint as it drops into that deep flexion position. Some other options you can try are to add in some tibial rotation. So placing the hands around the outside and inside of the joint, you can add in a rotation, so an external rotation of the tibia femoral joint here, for example, and you want to add that rotation in as you approach the flexion restriction. Add the rotation and then assist with further flexion to see if you can get some increased range. If that works, perform 3 or 4 repetitions. If that doesn't work, then the go-to is the other side, rotating in the opposite direction and bringing it into that end range flexion as well. And that can also work as you move out into extension, so maintaining the rotation and moving the leg out into extension, back again, rotating the other way and moving the leg out into extension. That may help to increase the range of motion. Another technique you can try is the anterior-posterior gliding of the tibiofemoral joint. This can easily be achieved. The patient can do it themselves by putting the thumbs behind, fingers in front, and then just attempting to move the tibia forward and back underneath the femur. And that can then be done in greater degrees of flexion. And these are all self-mobilization techniques for the knee, which may help to increase range of motion. Next, to load the knee, stand in a split stance lunge position and bend the hip and knee on the affected side to try and increase the range of motion. Once again, you can add in some tibial rotation. So turning the foot out for some lateral rotation and then dropping down into that lunge position. And then the other way, turning the foot in for the medial rotation and dropping down into a lunge position. Now, Rich is dropping all the way down here, which is fantastic. You may be able to achieve that, but if not, just go down as far as is comfortable. If you're struggling with that movement and the weight of your body pushing down over your knee, then simply use some upper body support from a stick or a chair or a table, for example. Another thing that you should add in is to bend the knee in medially and also to bend the knee out the opposite way laterally to really fully restore that range of motion in all directions as well as just flexion and extension. Even in the unlikely event that you do require surgery, these exercises will improve the strength around your knee and increase the chances of successful recovery after surgery. That's it for this video. Thumbs up, comment, and we'll see you in the next one.